This is Dr. Deuk. I'm here with one of my patients, and we just completed basically a lumbar decompression, realignment, and fusion. And our patient is willing to share some of his experience. Now, he had spinal stenosis in his lower back, had 2 discs, disc herniations, pinched nerves, a bunch of arthritis in the facet joints that made him enlarged. His spine was twisting with scoliosis, his bones were slipping with listhesis, and it was just a whole arthritic mess back there. How you feeling?
I feel pretty good. I feel a lot better than I did before in that area, yes.
So you just had surgery like 3 hours ago. You came out of surgery, right?
Yes.
And where are you headed now?
I'm going home.
Going home.
Going home.
After a lumbar fusion.
Yeah, to recuperate.
Now, did you have back pain before surgery?
Yes.
And is that pain that you had before surgery still there?
Not that pain, no, just
Different.
the surgery pain.
Different pain. And now, which leg was bothering you before surgery?
It was my left leg.
Do you have that leg problem anymore?
No, because, whoops.
All right, we'll just take it off for you.
No, the left leg is my stronger leg right now. Yes.
So that pain down your left leg, gone.
Yeah, I don't feel it.
All right. Well, we'll get you home and recovering, and I'll probably see you tomorrow to get your drain out.
Sounds good to me. Thank you very much.
You're welcome. Anything you want to say to the rest of the world out there?
If you need a good spine surgeon, come see Dr. Deuk.
All right.
He'll take care of you.
Thank you. Appreciate it.